I chose truck driving as a living. Being in the truck, you got a lot of freedom. You're out there, you're your own man, you know, and there's nobody standing over top of you telling you exactly what you got to do.
But when Hugh Williams' blood sugar spiked, he failed his work physical.
I think it was kind of a shock to him when they told him that he couldn't work.
Been driving a truck for 39 years, I don't know what else I would do. That's the lowest point of my life, I guess.
The drug abuse just got worse, you know. It was like a downward spiral. The more I missed out on life, the worse I felt about myself.
Michael Perry found himself out on the streets, homeless and jobless, all due to his addiction.
I was at that point of hopelessness. Do you really want to die? I'm like, no, I don't. But I don't know how to help myself. And I want to help myself.
By the time these veterans turned to the Fayetteville VA Medical Center, they had both hit bottom. Expecting business as usual, they were intrigued when asked to participate in a new type of patient-driven care called Integrative Health Coaching.
Integrative Health Coaching model is about treating the whole person, mind, body, soul, and spirit.
It's not, I'm going to the doctor and the doctor's going to take my blood pressure medicine and he's going to tell me I need to lower my salt. It is engaging the patient in their own health care.
I've got to get my A1C down so I can go back to work.
Nurse practitioner Janice Rogers recognized that for Hugh, traditional doctor's visits were not getting the job done.
So you were feeling okay,
Yeah.
and you had kind of gotten away from testing your blood sugars. What other barriers had you been running into?
Sometimes I wouldn't take my pills. I mean, not every day, you know.
Integrative Health Coaching offered Jan an innovative and dynamic way to empower Hugh, putting him in the driver's seat when it came to his own health care decisions.
Did anything kind of jump out at you?
Yeah, about everything.
Okay.
I hadn't done anything right. It was a one-on-one, and we met every week for an hour.
What steps would you like to take to reach this goal?
Well, we get the exercise bike. I'll start riding that and lifting that 20-pound weight. She didn't tell me what to do. She asked me, what did I think I could do?
Just looking at the wheel, you being in the center of it, how all these areas of your life actually really impact your health, and you being not even being mindful of it.
The components of proactive health and well-being, commonly called the wheel, is divided into segments, each representing a portion of a person's life. The personal health inventory is built around the components of the wheel and allows the patient to get an accurate idea of where they currently are and then look at where they want to be in their lives.
So it looks like you focused on the area of surroundings here. Okay.
Yeah.
It is important to ask what's important to the veteran because it allows them to gauge their motivation and also prioritize which goals they are looking to work on first.
If I don't tell you what's wrong with me, you can't help me.
So the next area on our wheel of health has to do with food and drink. You rated yourself as a 5, and you put down, I just don't eat right.
That's right.
Okay? But you really want to move yourself up to a 10.
Yes. When you're filling this thing out, if you're telling a lie about it, how you really feel that you're doing, you're not helping yourself because this is all about you.
If you can sum up for me, what really matters to Mr. Perry in his life?
Focusing on my recovery from addiction.
Once the inventory is completed, coaches work closely with patients to analyze their answers and help the patient formulate a customized healthcare plan with both short and long-term goals.
Doing that inventory, it kind of gave me a perspective of where I wanted to go. You know, I knew that I wanted to regain my relationship with God. I knew that.
And he felt like that's what kept him connected to his community, his family, and who he was coming up.
Without this crucial support, Michael had been unable to stick with any treatment program. This new holistic approach uncovered a need that traditional medicine would never have found. Reconnecting to his spirituality gave Michael the ability to set ambitious goals and stick with them.
We worked on being Michael Perry, the business owner. You know, Michael Perry, the daddy. You know, the uncle. You know, and the sun. We worked on that.
Hugh found his motivation somewhere else.
Miss Rogers asked me what was important to me. And I told her that working was the most important thing in my life.
He likes to be able to provide for his family, and that was a big motivator for him. He wanted to go back out on the road. So his health became personal.
As Hugh developed a new healthcare plan that revolved around diet and exercise, Jan was there to help.
We sent him to the dietary class.
We're going to look at the nutrition label. I have the Cheerios here.
I used to never look at a label. And now the first thing I do when I pick up a can of something, I turn it over and look at the label, look at the sodium intake and the sugar. When I lost all that weight and everything, I really felt better. I mean, I was beginning to feel like I was a young man again,
He's back driving his truck. I don't know who was more excited, me or Mr. Williams. I expected some change, but I did not expect this huge change.
His sessions with Ms. Rogers has helped me to exercise and weight, eating right, and I've lost weight too by doing it.
If the VA centers are not using this coaching, they should be, because it really helps. It gives you confidence in yourself and everything else.
And, empowered by that confidence, Michael is no longer homeless and has been free of drugs and alcohol for over 9 months.
It's a miracle to watch someone transition from who they were before and who they are now. His business is up and operational.
Every time I see Marcia, I thank her. That's all I want was my life back. I did the work to get it, but she pointed me in the right direction.
Yeah.